there too?
Yeah.
Okay.
So the idea is that our systems are broken, and this is, we're shining a light on the broken system of the mental health and the criminal justice system, and trying to raise awareness that the community has to become a place where hearts can heal. We can no longer give our loved ones and our vulnerable ones or let them be taken by the system because it breaks their hearts, their bodies, and their minds. This is a place where many hearts are broken. It's where my son has been put in isolation. So people can tell me. Oh yeah. My son has been put in isolation. I believe that he's been harmed in other ways here, and it certainly was not a form of rehabilitation, and being labeled incompetent was not also a form of help for anyone. The community's become endangered by the way that we treat the people within the jail, and I just want to say Clark County has, the jail has a high attempted suicide rate.
Highest attempted suicide?
No, not highest, but high. The average is 8 for a population of this size. And they had 11 attempted suicides last year. And they've already had 2 completed suicides. And also the life of an inmate was taken. They call it asphyxiation, that he was being held down by guards when that happened. So it's a broken system, and we, the people, have to come together and create communities where hearts can heal.
So this is a good place to do that, because this is where a lot of that traffic from the community and the youth from the community who are disadvantaged end up coming through this system.
Yes, exactly. The impoverished, the people of color, women, all of those folks that are not, that don't have the power, have been disempowered by the system. It's like it's time for us to take our power back.
Yeah, and I've heard even stories that when it comes to homeless people, they'll take them off the street. They're supposed to get them some help, but they'll take them off the street, and sometimes the cops will just dump them in another part of town, or even the hospitals. Kaiser was on the news a couple of years back for doing this, and they actually had a homeless woman that had mental issues, and she had substance abuse issues also, but they took her off the streets. They took her to the hospital at Kaiser, and they had her in there for a 2-day stay, a hold. No insurance, and so they couldn't help her. They let her out, and they dumped her off in the worst part of town without her wheelchair. Without her wheelchair, she was disabled. It's terrible.
Actually, when they released my son from Western State, because I was doing a lot of pressuring them, and so out of retaliation, all of a sudden they just decided to release him with no discharge plan, and they had him put on a bus that did not even stop in my city.
Wow.
And it was 2 o'clock. I had put it on missing persons police report, and it was 2 o'clock before I got the body. So.
Which city was it?
Lakewood, Washington, the hospital, because I was pressuring them and questioning their over-drugging of him. They thought the best way to get back at me was to just let him out in one day. No discharge plan, no real connection with the community team that was supposed to support him. Gave him $40 to put him on a bus in Lakewood, and the Greyhound did not stop in Vancouver at all. So it was crazy.
Yeah.
This is my daughter.
Yeah.
Oh,
this is Daniela Welch, and I took her to Mass General Hospital for some allergy testing. She was allergic to her plastic retainer, to the plasticizers in her retainer.
Oh.
She was taken into a separate room and put in 5-point restraints and injected with drugs. She was drugged to oblivion without my consent, without her consent. She was 16 years old. After 9 months in court, the state of New Hampshire took guardianship of my child. I'm no longer her legal guardian.
Oh no.
And I'm a teacher, and I'm a responsible mom, and the judge said I was too involved with my daughter. So I sought out help for her allergy, and she ended up in a lockdown psychiatric hospital for over a year. She was not let outside. She was knocked to the ground and injected with drugs and put in isolation. She never hurt anybody, and she's still a ward of the state, and she still has a 4-year commitment at this hospital. And I only got her out on an outpatient basis due to an enormous amount of community support, miracles,
Yes.
a pro bono attorney, and a couple good doctors, because there are a few good doctors out there.
A few, yeah. Yeah. But just for an allergy, they consider that a mental illness?
Yes, it got to the point where she was getting having seizure activity. And so I took her in for testing, and her hair was very sensitive, her head was sensitive because of the swelling from the allergy.
Ooh, yeah,
and
I
she
bet.
didn't want to do the EEG, so they said she was paranoid, and that's what they did.
Wow.
My name is Mary Clisby. I'm an activist, and I'm here to make a difference, and thank you so much.
And thank you. I seen you yesterday in solidarity with Cindy. That was so great. You guys were on a mission.
We're walking 100 miles, and SoWeWalk.com is our blog. This is also a fundraiser. We want to create respite homes in our communities.
That's so great.
And we want to find the help that we need for our own children to heal from the treatment they've gotten in the system.
Oh yes, definitely, definitely.
I so appreciate you, Tom. You've been at so many of the events where we've tried to raise awareness, you and Joe, and so kudos to these journalists.
Yeah, well, we've been helping a lot of veterans, a lot of activists, the mental health community, but you know what? That's the one out of the 3 that doesn't get touched on very much. And you know what? It's personal to me because I just had an episode a couple years ago where I had a breakdown. And that's just a temporary episode, but there's people that have that through their whole life. They have to deal with medications and deal with a system that just pushes medication at them and just gives you, like you said, they're legal drugs. They're pretty much legal drugs, and they're getting people addicted to for the rest of their life.
Scary part is they're giving it to the children. They're giving it to our children.
Yeah.
Yes, go ahead.
Yeah, sorry. He made a comment. He said he's not losing his morals when he grabbed that. So he didn't want to take it off the door, I think. Somebody told him something, I think.
It's hard. Come on, that's okay.
Sorry, guys.
We don't get you. They're just. We're shining the light on a broken system, the criminal justice system and the mental health system.
Drugs have our children against their will and against our will.
And with drugs that cripple them, that cause suicide, cause them to
Oh, wow.
Welcome to the USA.
Shining light on the mental health industry and the system, yeah.
They're drugging up kids.
Yeah, her son especially, he's been in the system for quite a few years.
1,200% overdose at age 17 of his first psychiatric drug was Paradol.
Are you serious? What did it do?
Within the next 6 months, he did self-cutting his arm, he burned himself, he was afraid he was going to jump out of the second-story window, and
Happy birthday yesterday.
Well,
Yes, happy birthday.
I'm 22 on some stuff. He's almost 22, and I was like, so he's off it, but I don't know. But I want to talk to you, but my brother's
And
in
so
we walk.com.
We're walking 100 miles.
And
spread
so
the
we
word.
walk
Come back if you're here.
We'll come.
Our prayers will be with
Look
them.
on this heart.
Thank you so much for everything.
Oh yes. Yeah, me and Joe are so happy to work with you guys, and through Sarah, I think it was, we met you, and that's so great. You know, the veterans thing is really good too, but this is a big movement, and you've kind of you fronted this organization, the M.O.M.S movement, haven't you? Kind of yourself? No, oh my gosh.
You know, we should stand in front of that sign instead of.
Maybe that would be better.
Yeah, that would be really good.
I mean, maybe there's a sign there.
Oh yeah.
Second, of course, yeah, to cover up the trash and just for one.
So,
But wow, we have a little change here.
Yeah. Oh, is there
What
plans
was
to
your
walk?
name? I didn't.
Oh, I'm sorry. I'm Tom. Nice.
Tom, I'm Aleshanee.
Oh, okay, Aleshanee. I
Really
remember
good
that.
to meet you.
It's good to meet you too. And I need
Mary.
Mary.
Yes.
I get the name a second time and I remember it.
You know,
Very
we're
Aleshanee.
asking people to walk with us, to share those
Yeah.
stories. We're asking for stories on our blog. I don't know if you might be able to help us think of a way to share those stories, but
Yeah.
we're going to ask people for permission to have them in some way publicized. if they want, we can change the names. But we've heard some pretty powerful stories, and please, if you can spread the word that this is a fundraising walk, and we welcome any kind of contributions, whether people want to walk with us, whether they want to donate through our blog. We have a PayPal button account, or just by sharing stories. We really appreciate it.
Both help the movement.
So, and Girls Together, what is the name of the blog? This is our way to take back our power. And so we walk.com.
This is our voice.
And so we walk.com, and that's where people can donate to the fundraiser.
Yes, and follow us on our 100-mile
And thank you so much.
Oh, definitely. And I'll walk with you guys. Yeah, we're going to one more building, right?
Yeah, we're going to the hospital.
We're going to
on 3030.
Oh, that's going to be good. I bet you. Government.
I agree with that, but I think he could take more risk and speak his truth. I know it's dangerous, and I know you could end up dead.
Yeah.
But because I advocated for him as a peace activist, and then right after he got the nomination, he dropped all of us, and then he took as his cabinet some of the Bushites, and it was like, this man isn't going to walk his talk when he gets in there, because here he is, he just got the nomination, and he's changing his tone. The Peace Health Hospital also operates this hospital, the major one over there. This is where my son, in his early years after being overdosed with drugs, was often taken. And because we are in a community that is mostly Caucasian, he was often isolated and put in restraints for extended periods of times.
Wow.
And it just has not been a place of healing, by no means a healing sanctuary.
And what was the name again? It's called Peace?
Peace Health is the main hospital. It's actually a huge conglomerate across the country. And it used to be Southwest Washington Hospital, and this was part of that, the psych ward. And then it just recently got bought out. Actually, from the beginning, when I first got here, it was Mother Joseph's.
Mother Joseph?
Yeah.
Where did I see Legacy? I don't know. I've seen. Maybe I've seen a sign out there. I've seen it for another place.
Legacy bought out this part instead of Peace Health by this, because it was a standalone kind of. So it's possible that they didn't continue owning this part of it.
Yeah, but it's still ran by that same agency still. Yeah, from what I know.
There still is a mental health component to this, and you can't go outside as long as you're here, because there is no, quote, contained place for patients to go out. Drugged, restrained, isolated. So
seems like it's taken a lot of energy out of you.
Yeah, I'm tired. And there goes Aleshanee. She's putting a broken heart on the door.
You better get that. How many miles have you guys walked so far?
I've got to go and figure it out. I know we did about 12 or 13 in Portland.
12 or 13 in Portland, and then now today is Washington, of course.
Today is Washington. We didn't go as far today because we're going to have this big walk tomorrow where we're away from friends and family and everything, and just on our own. So we decided that we would go home and take care of our blog, catch up on all of that, load up pictures,
Get rested.
get rested that too, somewhere in there. And get ready to go tomorrow. But I don't know how many miles it is. We started out at the Community Service Center, which is another place where one part of the building, they lock up patients. There's no access to outside. I think it's a 14-bed ran by Telecare. And so we started there. We gave a broken heart to Telecare and another heart for...
We let him videotape it. We got on the premises
Oh.
without